So most of the lipids found in the body fall into the categories of fatty acids and triacylglycerols, glycerophospholipids, sphingolipids and eicosanoids, cholesterol and bile salts, as well as steroid hormones and fat-soluble vitamins. These lipids have diverse chemical structures and functions. However, they are related by a common property. They are relatively insoluble in water. As such, a transport system for the distribution of major lipids is in place to aid in the movement of these compounds. So our system to move our lipids around, it involves a family of lipoproteins, and this is their general structure shown here. They have distinct roles in carrying dietary lipids, lipids synthesized through de novo mechanisms in the liver, as well as for reverse cholesterol transport. Globally, the similar characteristics are a central core, which will be the place at which they carry their lipid load, and this load will differ depending on the lipoprotein being discussed. And this is encapsulated in a single phospholipid layer. In addition to the lipid components of the lipoprotein, they also contain a protein component termed an apoprotein. The complement of apoproteins on each lipoprotein is unique and is a distinguishing characteristic of each family of lipoproteins. So they have several key functions. First, they activate certain enzymes required for normal lipoprotein metabolism. And two, they act as ligands on the surface of the lipoprotein that target specific receptors on peripheral tissues. So here is an abbreviated table from what is in your textbook, and this will help us focus what's most important. So these will be our lipoproteins that we're going to focus on, and those will be chylomicrons, chylomicron remnants, VLDLs, IDLs, LDLs, and HDLs. So it will be important to note where these lipoproteins originate from, what they carry, so what the major components of the lipoprotein are, as well as the characteristic apolipoproteins associated with these specific lipoproteins. Again, this is abbreviated from the larger table in your textbook, but this will serve as a nice guide as you go through the week's material, and this will be our major focus. We'll talk specifically about each of these lipoproteins in subsequent discussions. So quickly, chylomicrons. These originate from the intestine and will carry dietary fats and cholesterol, as well as fat-soluble vitamins. This is in contrast to VLDL, which carry fatty acids from de novo synthesis in the liver. The fatty acids are packaged into triacylglycerols, which are loaded into VLDL particles along with cholesterol before leaving the liver. IDLs are a maturation product of VLDLs, and the same is true for LDLs. HDLs, however, can originate in several different locations, primarily the intestine and the liver. And these will be focused on in their role in reverse cholesterol transport. We'll also talk specifically about the role of each of these apoproteins in subsequent discussions, but this will serve as a good reference for you as we move through the week. So we'll finish with this quick question, which I think most people can relate to. If you've ever been for a well care visit, oftentimes you're asked to fast for 24 hours so they can draw blood for a lipid panel. So I'm going to ask you the question, which lipoprotein is most reflected by the triacylglycerol component of that lipid panel? So based on our table, we know that there are two primary lipoproteins that carry triacylglycerols, chylomicrons and VLDLs. So we know that chylomicrons carry dietary triacylglycerols, whereas VLDL carries triacylglycerols synthesized through de novo synthesis in the liver. So in this case, when you fast for 24 hours, the triacylglycerol component in a lipid panel is most reflected by the levels of circulating VLDL. What we'll see is that chylomicrons are rapidly cleared from the bloodstream after a meal and do not largely contribute to the triacylglycerol component when you go to the doctor and have a lipid panel drawn.